Are you like me and millions of other people? You're dealing with lower back pain? Well, let me tell you something. It is not as hard as you think to get rid of. There are typically two types of lower back pain that are the most commonly seen. Number one is flexing too much, or a flexion type of lower back pain injury. The other one is an extension type or an extension intolerant type of low back injury. So if you're wondering which category you fall into, whether it's flexion or extension type of back pain, typically with flexion, you will feel worse when you sit and drive, and you'll feel much better when you get up and move. So let me show you how to clear up that flexion type of lower back pain so you can get better, not older. So number one, we have to take out the offending activity. So if you're bending over a lot because you're working in a warehouse and you're lifting boxes, we need to learn how to do these movements properly. So number one, a little bit of tension on your core and learning how to perform flexion of the hips, not flexion of the spine. The spine is designed to flex, and it can do it sometimes, but if you do it too often and under load, that's when you're going to break down. So mastering the hip hinge to pick things up is going to be your number one source to help you get over this problem. Key to getting rid of this type of pain is to find what we call position of preference. So we're going to start all the way down, and we're going to work all the way up and find what is most comfortable. The first position is going to be a simple flat palms and just hang out until you feel better. Then we're going to go up to fists stacked, wait till we feel better. Then we're going to go to here, and then from here we're going to do a little bit of traction where we pull the elbows back, dropping the ribs down and getting a nice stretch in the upper lumbar spine. Once we do that, we're going to play around with a full press up. Hang out at the top for a couple of seconds, blow your breath out, and if you don't feel really great there, then let's play around with leg position. To me, this always makes me feel better because I have a right-sided back issue. If you have a left-sided issue, you can try this. Now, whichever one feels best, I want you to stick with that. Do that repeatedly until you feel better. So once you've established your position of preference and you're starting to load that spine and extension and you're feeling better, we want to get a nice neutral spine and a nice normal contraction out of your core and your paraspinals. The bird dog is one of the best ways to do that. We're going to basically try to keep a nice soft lordosis or arch in the spine. We don't want to be hyper arched and we don't want to be hyper flexed. We just want to be comfortable. So wherever this feels best is where we're going to hang out. We're going to slide this leg back, pick it up just until you feel your glute, and then this arm is coming up. I like to hold this for 10 seconds to establish nice muscle contraction. And I'll even do a few reps on the same side. You can also alternate. The idea here is to reestablish a normal nervous system pattern so your glutes are firing and your brain thinks that everything is okay with your spine and it's not freaking out, creating muscle spasm. So because this is a forward bending type of injury, we want to avoid those forward bending type stretches. So we're going to do a nice hip stretch here called the Pigeon, and that's so you can maintain flexibility in your hips so you can do a nice hip hinge. So I'm going to use a bench here. You can use your bed, couch, or you can even get on the ground for this, but it's very simple. All we're going to do is sit obliquely at about 45 degrees. This leg's going to come up here. I'm going to put my ankle underneath my knee like this, and I'm going to keep my sternum, which is my chest bone, right over my knee, and I'm actually going to pull myself down, but I'm going to keep my chest up and keep my back in a good lordotic or neutral position. I'm going to take 10 deep breaths, and then I'm going to switch sides so I'm equal on both sides. And again, I'm not flexing, I'm keeping that chest up, I'm coming forward, I'm getting that glute on this side and that piriformis nice and loosened up. Now the last thing we want to do is we want to get your glutes activated, especially your glute medius. So we want to keep the spine neutral, we want to push away from the ground so we have nice alignment. We're going to clam this top leg up, keep some core tightness, drive this knee into the ground, and we're going to hinge through the hips, up and forward, keep the core tight, down and back. And we're just going to go nice and steady, 3 up, 3 down, until you feel some fatigue on that down side. And then we're going to switch sides. So there's your quick fix on how to get rid of that forward bending or that flexion type of back injury. Stay tuned for my next video. We're going to show you how to get rid of that extension type of back injuries. And don't forget to hit that like button, subscribe, so you can get better, not older.